Good evening. I'm Nurse Kay, and I will be taking care of you. You are here for your procedure, is that correct? Good. Well, I work in this pre-procedure treatment unit, and I will be prepping you this evening. And I see you are with one of my favorite doctors, so you're in good hands. So I have your name here, and I just have a few questions before we start getting you ready. Alright, so first of all, have you had any prior surgeries? And nothing like this before, right? Okay. And have you ever been under anesthesia before? Alright. Well, it's nothing to be worried about. I will tell you a little bit more about it soon. So, since you've never been under, no bad reactions. And what is your medical history? Any major health issues? Okay, and does that run in the family? Okay, any allergies? Do you drink? Smoke? Okay. Let's see here. Any history of excessive bleeding? Good. And how much water have you had in the past 24 hours? Good. So you followed the instructions. Overall, would you say you're nervous for this procedure, or are you pretty calm? A little bit. Like I said, you're in good hands, so you have nothing to worry about. Right. Let's see. Are you currently taking any blood thinners, blood pressure medicine, or diabetes medicine? Any other medications taken in the past 24 hours? Yeah, that's fine. Thank you for letting me know. Okay. Any contacts or jewelry that needs removed? Okay. Very good. And then, lastly, do you have transportation home after the surgery? In the waiting room? Perfect. Well, I'll make sure they're updated throughout the procedure, alright? Well, now we can get started with the short exam. And the exam's purpose is to just make sure everything's normal before going into surgery. I will be doing the basic things, checking your heart, your blood pressure, doing just a brief eye exam, again, to make sure everything's normal. and then I will be giving you an IV. And then shortly after that, the anesthesiologist will come in and administer your anesthesia. Alright? So let's just get started with the exam. Just gonna put on a little bit of hand sanitizer. And really, this is a relaxing exam, so you don't have to do anything. You can just continue laying on the bed like that, and let me know if you need me to stop. Alright? So first, let's listen to your heart and lungs. And I'll just have you take a deep breath in when I say. Just going to place this under your shirt. Okay. And deep breath for me. Good. And another one. Good. And another one. Good. And another one. Good. And one more. Good. Now, if you don't mind, I'm going to listen on your back as well. Deep breath in for me. Good. Another one. Good. And one more. Good. Okay. Everything sounds normal. Now I'm going to take your temperature and then your blood pressure. Alright? So first let's do the temperature. Okay. Just going to sanitize it. And I just need you to place this under your tongue, and it will just take a moment to read your temperature. Alright? Okay. So, right under your tongue. Perfect. And we'll just give it a moment here. Okay. Perfect. So you do not have a temperature, which is what I expected. Just get out my blood pressure cuff here. And you can just slide your arm right through there. Just put this tight around your arm, just like that. Now flip your arm over. Very good. And I'm going to attach this right here. Perfect. I'm just going to place this under here. So I just need you to relax for me, okay? Alright. Just stay relaxed. and then we're going to move on to the eye test. Okay. So I'm going to need you to just read the letters for me, okay? So let's start right here. Very good. Now, what about this one? Very good. This one? Good. This one? Good. And this one? Good. Can you tell me what color this is? Good. And what color is this? Good. And what circle is larger? This one or this one? Good. This one or this one? Good. Now I'd like to just take a look at your eyes. So can you just follow this light for me? Back and forth. Back and forth. Good. Now continue to follow it. Just going to move it around in front of you. Just keep following. Good. Okay, and then just look straight ahead and keep following as I move it closer. Okay. Very good. And can you just look up for me? Good. And look down. Left and right. Okay. So now I just need you to tell me which fingers are fluttering. My left fingers or my right fingers. Good. 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 Okay. Now I'm just going to briefly look in your mouth. Can you say ah for me? Good. And just stick out your tongue. Good. Okay. Good. No redness. Now I'm just going to take a quick look at your ears. So start with the left ear here. Take a look inside. Make sure everything looks normal. And that's not hurting, right? Okay. Good. Let me check your right ear. And that's not hurting either, right? Okay. Good. Okay. Perfect. And lastly, I'd like to just palpate your face and just look for any abnormal discomfort you might experience. Alright? Just feel under your eyebrows. How does that feel? Okay. Just going to touch into your eyes very gently. How does that feel? Okay. Then your forehead and your cheeks. Any discomfort? Okay, good. Okay. Very, very good. I think at this point, you are ready for your IV. Passed all of the tests before the procedure, so everything's looking good. So let me just get my supplies ready. So have you had an IV before? Okay, well there's nothing to worry about. And are you queasy around needles, or are you typically okay? Okay. So just relax. You can close your eyes, open them, whatever you feel more comfortable doing. So first, I just need to see which arm I'd like to use. So let's see, your left first. Okay. Can I see your right arm? Alright. I think I'll go with the left. Not too tight, right? Good. Now I'm just going to palpate your vein. Okay, so it's right there. Now just keep your arms straight for me, because now I'm going to disinfect the area. So like I said, I'm just disinfecting, okay? Now I'm going to get my needle and what I'm going to have you do is take a deep breath and then hold it, and then I'm going to count to 3. That's when I'm going to insert it, okay? Only take a moment, and you'll just feel a sharp pinch, and then it will be over. Alright? So, deep breath for me. Very good. 3, 2, 1. Okay. Very good. Just going to put some tape over top. Very good. Alright, so you can just rest your arm right there, and now your IV is in place. So I'm going to get the anesthesiologist so we can get you prepared. Alright? I will be right back. Okay, so I just spoke with the anesthesiologist, and she'll be in a moment. And just a reminder, you will be in a twilight, so not fully asleep. And after surgery, you will be transferred to the post-op care unit, where I will be there waiting for you. And once you're awake, your friend can come and visit you. And like I said before, I will be giving updates throughout the procedure so they know how it's going. Alright. And I'll also provide all the discharge information to them as well. And then after the procedure, once you are out of your twilight, the doctor will give you detailed information on pain management, what prescriptions will be sent to the pharmacy, and everything like that. Okay? Do you have any concerns? You're just ready to get it done. Okay. Well, you are just about ready to start. Like I said, I will see you when you wake up, and you will likely be very groggy, so I'll just be taking care of you at that point. Alright? Well, you are going to do a great job, so I will see you when you wake up. Hello again. It's Nurse K. I'm happy to say your procedure went very well, and you are now in the post-op care unit. Your friend will be here in a moment to say hi to you, but you can just feel free to continue to relax. I'm assuming you still feel groggy, right? Yeah. Well, just take your time waking up. There's no rush. I put some water right there next to your bed and a few pills that the doctor would like you to take right now for pain. And he will be in soon. And what he'll do is just give you an overview of the surgery and how everything went. Like I said, I was successful, which is great. And he'll also tell you what to expect for the healing process. And then for the prescriptions, I'm going to just double check and make sure they were called into your pharmacy, which I have right here. So I'll make sure they'll be ready so you can pick them up on the way home. Okay? So you can just continue to rest your eyes for a bit. The doctor will be in shortly, okay? It was a pleasure being your nurse this evening, and sweet dreams.